Hello, my name is Kim from St. Louis University. In this presentation, I would like to show a few cases of root contact with miniscrew. Although miniscrews can be placed in various areas, the inner radicular spaces are the most common sites. These sites have an increased risk for causing iatrogenic root damage and require extreme caution during planning and placement. We may see some cases in which miniscrew seems to be in contact with the root. If that's the case, we would like to know, is there real contact? Will there be any problem? These are important questions to answer. This presentation will discuss the problems of two types of screw contact. First, contact at screw insertion. Second, contact during tooth movement. So first, screw contact at insertion. This is a 16-year-old male patient with anterior open bite. The miniscrew was placed between mandibular second premolar and the first molar for molar intrusion. During insertion, the patient felt pain at the medial side of the mandibular first molar. CBCT was taken right away and the root damage was confirmed. The screw was removed and placed at another site. 12 months later, and there were no specific signs or symptoms. This is a 19-year-old female patient who has some crowding and crossbite. Two miniscrews were placed between mandibular first and second molar for distalization of the mandibular dentition. During the placement, the patient had pain at the medial side of the second molar. CBCT was taken immediately afterward and root damage was confirmed. The screw was removed and put at a different location. The pain resolved immediately after screw removal. 13 months later, there were no specific signs and symptoms. Now I'll show two cases of screw contact during tooth movement. 28-year-old female patient presented for the correction of anterior crowding. The miniscrew was placed between the mandibular second premolar and the first molar for distal movement of lower posterior teeth. During retraction, the screw seems to be in contact with the mandibular right second premolar root. However, no pain or other symptoms were reported. The CBCT showed the root damage by the screw. After confirmed root damage, the screw was removed. These are 12 months after the root damage. 22 months after root damage, there were no specific signs and symptoms. This is an 18-year-old female patient presented for generalized spacing. Miniscrew were placed to distalize the upper dentition and mesiodistal the lower dentition. During the treatment, the screw seems to be in contact with the root of the mandibular left second premolar. The patients did not report any pain or other symptoms. The root damage was confirmed by CBCT, and the miniscrew was removed. 12 months after the root damage, there were no specific signs and symptoms. According to Brissino's study in AJODO, under favorable conditions, healing may occur when root damage caused by miniscrew is limited to the cementum or to the dentin. By Dr. Kim's study in AJODO, immediate removal of the miniscrew leads to cementum repair, whereas leaving the miniscrew in place will cause either a delay in repair or no repair. So our recommendations are, it is important to obtain a CBCT for confirmation when there is a risk. As soon as root contact is confirmed, orthodontic loading should be stopped and the miniscrew must be removed. In the cases we have presented, when miniscrew were removed immediately after root damage, there were no pain, discoloration, devitalization, or ankylosis. The contact between the screw and the root did not disturb the movement of the tooth or provoke screw loosening. Thank you very much.